Hello, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created HealthScore. HealthScore is a comprehensive program to optimize health and extend life. In my over 10 years of practice, I've been able to help improve the health and support increased lifespan for thousands of patients. Now, HealthScore is available to the general public, to anyone who wants to optimize their health and extend their life. HealthScore is based on 31 recommendations in 4 domains: psychological health, sleep and activity, nutrition, and your numbers or biometrics. HealthScore consists of 31 recommendations that have been identified in the peer-reviewed medical literature and are the most important contributors to health and longevity. Today we're discussing, in the domain of psychological health, recommendation number 9, live with others. Definition. The definition for this recommendation is clear. Living with someone means sharing a common living space. What is the evidence that living with someone actually affects your health? Here's the evidence showing the connection between living alone and health outcomes. This is the study. It was published in the Journal of Perspectives on Psychological Science. It's a systematic review and meta-analysis published in 2015. Over 3 million adults were included in the review, and the average follow-up for the studies included was 7.1 years. The outcome of interest was, does living alone result in increased risk of death? And the investigators found that indeed, during the 7-year follow-up period, people who were living alone during that period had a 32% increased risk of dying during the follow-up period compared to those who live with others, which you can see on this graph. 32% increased risk of death for those living alone compared to living with others. Why exactly is living alone so bad for you? Living alone is connected with 2 pathways that can lead to poor health outcomes and premature death. One pathway, the indirect pathway, is through behaviors. People who live alone are more likely to smoke, be physically inactive, and get insufficient sleep compared to those who live with others. There's also a direct pathway through physiologic processes. Specifically, the following biologic markers are more likely to be elevated or abnormal in people who live alone: increased blood pressure, increased C-reactive protein, which is a marker of inflammation, and inflammation is implicated in many processes that result in aging. High cholesterol levels, which puts people at risk for cardiovascular disease, and poor immune function, which makes people more likely to be susceptible to infections and then have a harder time recovering if they do get sick. So, if you do live alone, is there anything you can do about it? Fortunately, there is. Find a roommate. Now, this is probably the hardest recommendation I give patients when I'm administering HealthScore. So many of my patients are so happy to be living alone and not sharing an apartment with roommates in San Francisco. Living alone in San Francisco with the rent as high it is considered a coveted luxury. Most people who live alone prefer to keep things that way. But though there may be many advantages to living alone, improved health, unfortunately, is not one of them. So if you're living alone, I do recommend you find a roommate. There are no frequently asked questions for this topic. In summary, we've talked about the health impact of living alone and the effects both directly and indirectly on your health. I described a pretty obvious, though potentially bitter, treatment for living alone, which is finding a roommate. I hope this video has helped. If you do live alone, I wish you best of luck in finding a roommate, and I hope you're able to find a roommate who puts the seat down. I appreciate your time and attention. Thank you very much.